A privilege to be here. We've been trying to arrange this presentation for quite some time, and I was really eager for the day to come. I kind of got a little cold driving from Yuma yesterday to deliver a presentation on the Affordable Care Act and on Social Security to the Arizona's children, and I was, one of my eyes was crying really, and I said, oh man, am I gonna make it tomorrow? And then I had to do some things today, and I still was kind of, I said, I cannot miss. I told my wife, I am not gonna miss that. I really want to be with the nurses group, and I am really happy. Let me ask, have you ever been at a presentation on the Affordable Care Act? Raise your hand if you have. Only one person, 2, 3. That means we're writing history. This is a historic thing. The Affordable Care Act is a huge thing. It's a historic event. Many presidents have been trying to reform our healthcare system without success, but this time it worked with much debate, much controversy. It continues to be controversial, but my job today is to try to get the politics out of this issue and really present some tangibles, some concrete items that are taking place, whether we happen to be on one side of the aisle or not. There are just some tangibles, and my job, and wherever I go, is to try to get the politics kind of out of the way so that we can analyze and have this conversation about the Affordable Care Act. I'm going to have to give you this one. I believe I have an hour, and I'm going to put a timer there. 3 years ago, I went to my state director and said, David, his name is David Mitchell, I want to start a community educators program because I am convinced that there is a great need of education on Medicare, the Affordable Care Act, and Social Security. To make the long story short, he blessed me and said, go on. I am not an expert, but someone has to do it. And I've been educating myself. I have never gone to any workshops. I educate myself, I read the books, and then I go on and present. So I recruit volunteers, I train them to basically do what I'm about to do. I hope, and I think they will do a better job than I do. But I guarantee you I'll share some things that you probably don't know, so that's something that makes me happy. Here we go. How many of you are convinced that there was a need to reform our healthcare system? Raise your hand. Perfect, I don't need to convince you. Many people without health insurance, 47 million, they were using that figure back then. No access to health insurance. If you have a job and you have group health insurance, you got it made. Other than that, navigate, and it's going to be tough. So we also have the issue of pre-existing conditions being, your policy being terminated the moment you get sick, when you most need the help. That's another issue, right? Discrimination against pre-existing conditions. The cost, you know, even though there's some criticisms that the healthcare reform doesn't do a lot to curb, if you will, the cost of healthcare. But after we go through this chart, which I developed, typically you're used to PowerPoint, right? And I know how to do those too. Actually, I do have them. But I deliberately decided not to have a PowerPoint. And I created a chart to give you a visual, and we're going to see how the healthcare law will benefit 4 groups of people. 1, people with health insurance. 2, people without health insurance. That's the biggest chunk of the law, that second column. And then people with Medicare, and then small business owners. how is the law going to benefit these groups? All right? I'm going to skip column number 2, and we'll leave it to the end because that's where the meat of this presentation is. We're gonna go kind of fast with the others, and then we're gonna focus on people who do not have insurance. Number 1, if you work and you have insurance through your work, you know, there's a lot of people, I'm in that category, have health insurance. This is what's gonna happen. Are you ready? We're gonna go kind of bullet point by bullet point. The first thing we gotta see is that any premium increase that is more than 10% has to be justified. Insurance companies will not be able to increase their premiums just because. If it's less than 10, then yes. If it's more than 10, they have to justify it. They are obligated to use on care 80 to 85% of premiums. You know, insurance companies get their money from premiums, right? So they have to use 80 to 85% of that on care. So they're limited somewhat, that kind of motivation to make a lot of money for bonuses and all that. So there's a little bit more restriction on that. We understand that there's a ratio in the premiums based on age, gender. They charge more if you are, for instance, a woman, if you are older. Well, the ratio has changed. You will still get charged. There will still be differences in premiums, but the ratio has changed. Let me just say that if it was a 1 to 5, it's probably going to be 1 to 3. So that ratio, the difference, the amount that they charge more will also change. Beginning in 2014, they cannot drop your coverage if you get sick. That's another big issue. We hear this a lot, right? As soon as you get sick, they find a reason and they just stop the coverage. That's not going to happen. Right now, pre-existing conditions, if you have a son or daughter that is 19 or younger, the protection against pre-existing conditions is in place already. In other words, they cannot discriminate a person 19 or younger due to pre-existing conditions. They still have to cover you. That protection will be extended to everyone in 2014. January 1 of next year, the protection against or related to pre-existing conditions will go to everyone. So insurance companies have to take you whether you have a pre-existing condition or not. How many of you are aware that insurance companies place limits on coverage? There are lifetime limits and annual limits. The lifetime limit, gone, thanks to the Affordable Care Act. The annual limit will be gone by 2014. So January 1, 2014, no lifetime limit and no annual limit. And one thing that is very important, insurance companies have to provide preventive services. And this is a huge emphasis of the Affordable Care Act. We will improve our healthcare system as we become healthier. Are you for being healthier? Can I give you just a personal testimony? I have kept myself at 195 pounds, 195 to 200 for about the past 15 years. I felt good, no problem. My daughter is becoming a registered dietitian. So she said, Dad, have you noticed that you eat 21 portions of sweets every week? Because I had dessert every single meal. I'm not kidding you. I stopped. The last month I stopped. And now I'm at about 186, 87. Just by doing that. I had lost no energy. So we need to eat better. We need to take care of ourselves. And by having access to insurance, we're going to be able to take care of preventive services so that we take care of our health and not wait until we're really sick and then go to the doctors, and then that is more costly. So preventive services are very important. All right? Do you like this?
Yes.
This is how it's going to benefit those of us who already have group insurance. Let's go to the third group now. One thing, as AARP, we heard from our members that many did not like the Affordable Care Act. AARP endorsed the Affordable Care Act. Not because we thought it was a perfect law, but we really felt it was a great beginning. There's still more to be done to it, and there's some benefits that the people that we serve are going to receive by the healthcare law, and that's one of the main reasons why we felt we needed to endorse the Affordable Care Act. I don't know if his name, Len Kirshner, sounds familiar, but Len Kirshner is a former Access director. He is a former AARP Arizona state director. He was with us for a few years, and he traveled the state giving presentations, and he always told us, when you talk about the healthcare law, a lot of people hate it. But as soon as you get into the details, most people love it. It's because once you understand what's in the law, the benefits, the spirit of the law, the reasons why, then you start getting it. Of course, there's always the concern of how are we going to pay for it? And that is a very genuine concern.
David, talk about how you lost a lot of your members when you endorsed, and then also when we had President Bush, you endorsed.
Yeah, I mean, some people accuse AARP of being partisan, of being in the Republicans' pocket or the Democrats' pocket. When President Bush when President Bush signed into law Medicare Part D, we endorsed that. And we lost a lot of Democrat members. And then now that we endorsed the Affordable Care Act, we lost a good number of Republican members. So it's difficult when 1/3 of your membership is Republican, 1/3 Democrat, and 1/3 is independent. Yes?
Just a question about the group with the health insurance. I know some people are also worried about companies not providing insurance and paying the fee because it's going to be cheaper for them to pay for the fee versus provide insurance.
That can happen, and that can happen, yes. Some companies, and I'll get to that in the last group, some companies might prefer to pay the penalty. But let me tell you, those penalties are going to be substantial, so they're going to have to think about it. But it can happen. So let's go to the third group. How is the healthcare law benefits people on Medicare? Okay? Number one, when people join Medicare, they used to and still do get a welcome to Medicare exam, free. And that was it. Now, thanks to the Affordable Care Act, they have an annual wellness visit for free. So that was added thanks to the Affordable Care Act. That means every year.
What is a wellness visit?
Yeah,
What
good
does that
question.
include?
It's basically a conversation with your doctor with the purpose of finding out how you can improve your health, given your current situation. You might need to work on your cholesterol levels, diabetes, or what have you. So it's going to be a conversation where your doctor will recommend some things for you to do to improve your health. In simple words, that would be the wellness visit.
And they can bill for it.
Yeah?
And they can bill for it.
They can, but the person for the Medicare beneficiary is free. But Medicare will cover that. Or I should say, yeah. Okay, so that's added. How many, okay, and then preventive care. How many of you, okay, wherever I go, I carry the Medicare Bible, Medicare in You. It's very interesting that there is a whole page here devoted to all the services preventive services included now for people in Medicare, free of charge. So now, people on Medicare will be able to get services for free that before they would not be getting.
When you say free of charge, you mean no copay?
Correct, correct.
But who's going to end up paying for all of that? That's where.
The Affordable Care Act is going to pay for that.
With our money.
But we pay for that. Who is, you know, where does that money for the Affordable
The Affordable Care Act,
come from? It comes
Yes.
from us.
well, of course. I mean, everything comes from us. We pay taxes. There are some savings that the Affordable Care Act is going to obtain from the system. For instance, let me just say one. Insurance companies that provide Part C plans, Medicare Advantage plans, have been getting, since the 90s or even before, a subsidy of roughly 14% extra. That 14% will be decreasing until Medicare spends on those plans the same as Medicare spends on original Medicare. Because there's two options of Medicare, original Medicare and Medicare Advantage. So when somebody signs on Medicare Advantage, what Medicare does is they have a portion for Part A and B and give it to the insurance company to take care of it. Well, they added some 14% to that amount. So now they're not going to do that gradually. So that's going to create some savings in other areas.
And I just want to make sure, you know, David is presenting what the law is. The law is the law now. We can get into philosophical discussions when he's done, but the purpose of this meeting is for us to know what the law is. So he's the messenger. If there's a problem with it, you know, it's not his fault. It's passed. So, you know, and I know he can handle himself because I've seen him with seniors. And that's happy. But I just want you to know that he didn't develop the law.
Right.
He didn't write it.
Right.
Bertha?
Yes.
I just have one question. Do you see the Medicare Advantage plans disappearing?
Do I see them disappearing? So far they haven't. Can it happen? They have the right to do so if that's what they want. Yes, it can happen. Have we seen them happen? I'm not aware at this point. Yes. But
But if they're not obligated to cover these preventive services, it would be, I mean, it wouldn't be a good idea to take an Advantage plan if they're not going to cover some of these preventive.
remember,
They're
Advantage plans, they want your business. So they will find ways to attract the business. Simple as that. Yeah, the question is, what is an Advantage plan? The Medicare program offers coverage for hospital Part A, doctors Part B, and prescription drugs Part D. And you can have that coverage either by traditional Medicare or by Medicare Advantage, which is an HMO type of insurance. Did I do a good job?
You did.
Oh,
It makes perfect sense.
all right, so here, let's continue. So there will be preventive services for our older adults, people in Medicare. Now, raise your hand if you have heard of the donut hole. All right, let me explain it in very simple terms. How are we doing? Okay, within Part D, the way the law was written, the way Part D operates, this coverage, it's a coverage that has 3 stages. And depending on what the plan pays for prescription drugs and what you pay, that money is added. When you reach a certain amount, which is roughly $2,900, you move to the 2nd stage of coverage. And on that 2nd stage of coverage, the plan helps you with 0. You pay the full amount for drugs. That's the donut hole. Is that clear?
Yeah.
Did I do a good job?
Again, don't get mad at him that that's
No.
the way that it is.
The good news is